Hi, I'm Dr. Pridhu Vyas. I'm a vitreoretinal surgeon at Adya Eye Care Hospital. I'm going to talk about the common retinal disorders. The retina is one of the most important part of the eye which contributes to the vision. This retina can be affected at any age group, starting from infancy to the elderly. The common retinal disease we see in the infants is retinopathy of prematurity. This retinopathy of prematurity usually affects the infants who are born preterm, that is before 34 weeks of gestation, or infants of low birth weight, that is less than 2.5 kgs. This retinopathy of prematurity has to be identified at the earliest in order to maintain the vision of the child. Usually a pediatrician advises the patient's mother or the father to get an ophthalmic checkup at the earliest. ROP has to be checked as early as 2 weeks after birth in order to retain the vision of the child in the future life. The second group of individuals are the kids and children, especially those with the minus power glasses. These kids with minus power glasses can have retinal degenerations or holes, which if not treated can lead to retinal detachment and complete loss of vision. Hence, we need to identify these holes or retinal degenerations and treat them with a simple laser so that we can avoid the complications like retinal detachment. The third group of individuals are the young adults, especially those with diabetes, hypertension and kidney disorders. These people with diabetes or hypertension develop what we call as diabetic retinopathy or hypertensive retinopathy. This diabetic retinopathy is a progressive disease and decreases the vision very silently without any symptoms initially. So in the initial 2 stages of diabetes retinopathy, the patient may not have any symptoms. Hence, one needs to get an eye checkup, particularly retina checkup, at the diagnosis of diabetes and proper follow-up as advised by the retina specialist. The next group of individuals are the elderly people who develop a common disease called as age-related macular degeneration. As the name suggests, it is age-related and commonly occurs after 5th decade of life, and it affects the macula, which is the most important part of the retina. This macula contributes to the central vision. Hence, the elderly people who start developing this disease usually complain of decrease in vision, especially the central vision, and difficulty in reading. So this age-related macular degeneration has 2 forms of disease. One is dry and the second one is wet. If identified at a stage of dry form, we can delay the progression into the wet form by appropriate treatment. With the present lifestyle, another retinal problem commonly seen nowadays is what we call as central serous retinopathy. It occurs in individuals with stress or lack of sleep. This disease can be identified very easily in the early stages, wherein the patient usually complains of decrease in the central vision. It can be treated with minimal medication and change in the lifestyle. So to conclude, the people who are more prone for retinal diseases include infants who are born preterm, kids with minus power glasses, adults with comorbid conditions like diabetes, hypertension or kidney problems, and the elderly. Thank you.